Am I going to be patient-centered or I'm going to be money-centered? This is a battle like I literally fight every day in my life. Okay, it's the patient first before the business. It's the patient first before the money. Hello guys, welcome back to my channel. My name is Yomi Bayode. If you are new here and you're watching me for the first time, I create content that relates with faith, health and lifestyle from Abuja, Nigeria. And as you can see from the title of today's video, I'm going to be talking about the pros and cons of working in a community pharmacy, specifically in Nigeria. You guys, I made a video a few weeks back talking about the differences between the hospital pharmacy and the community pharmacy in Nigeria. If you haven't seen that video, what are you waiting for? Make sure you click on this link and you watch it. I'm going to be talking about the pros and cons of working in a community pharmacy in Nigeria. This idea came from the last video that I made. So if you're a pharmacist and you're watching me and you're thinking about, should I go for the hospital pharmacy or I should go for community? Well, you would know the advantages and disadvantages of working in a community pharmacy in this video. If you think this content is something that interests you, make sure you definitely keep watching. Also, if you haven't subscribed to this channel yet, tell me, what are you waiting for? Please make sure you subscribe and turn on your notification bell so that whenever I upload a new video, you'll be notified by YouTube. If you like the content of this video, you know I will do it. Do not forget to give this video a thumbs up. Without further ado, let's get right into the video. What is a community pharmacy? A community pharmacy is a pharmacy that you can find in your community. Just in simpler words, a community pharmacy is a pharmacy you can find just very close to your office, the pharmacy you can find along the street, the pharmacy you can find anywhere around you, the pharmacy you can find in the mall. That is your community pharmacy. So what are the pros and cons of working in a community pharmacy? First advantage of working in a community pharmacy is that you have a direct contact with your patient. You're able to communicate with them directly. Someone walks in and tells you, okay, you know what, I've been having a day for the past few days. Can you give me Panadol? Can you give me paracetamol? Or can you give me anything? Can you recommend something for me? That's one of the advantages compared to the other fields in pharmacy where you do not really have a direct contact with your patients. You don't even see who you are manufacturing the drugs for or who you are procuring the drugs for. Now this leads me to my next point, which is what I call providing a direct medication therapy to your patient. In a community pharmacy, because you have a direct contact with the patient, you are able to provide a direct medication therapy. You are able to decide, okay, this is a particular drug that suits this patient. You're also able to advise them to go see a doctor if the symptoms persist. You can follow up with your patient or your customer personally. You are able to call them on the phone. You know what? You were here to get malaria medication a few days ago. I just want to know, how are you feeling? How is your body? And are you responding? You're able to ask them if they are responding to treatment. That's if you were able to get their contact on the day they were able to come to the pharmacy to get the medication. This doesn't really work in the hospital setting because firstly, you do not even have a direct, you have a direct contact with the patient, but you do not have that rapport, in quotes. You do not really have that rapport. So yeah, direct follow-up with the patient. And this leads me to the next point, which is having a network, or what would I call it, having a personal relationship or building a network of community. Community pharmacy is like a pharmacy in a particular location, so you're able to know, okay, who is your next neighbor or who is this person. Because of your work in a community, as a community pharmacy, you're able to network with other individuals in the society. This leads me to the most interesting point, which is getting good tips from kind customers, or let me say kind patients. You guys, this is one of the very good advantages of working in a community pharmacy. People come to you, and as soon as they say that they get results, they get to give you something, they tip you something. And for some people, this has been like a changing point in their lives, because you're probably kind to someone, or you even go out of your way buying a drug for someone. It just leaves a lasting impression that there's something different about this person, there's something nice about this person. And I'm going to talk personally from my own experience. In fact, you guys, community pharmacy has opened a lot of doors. When I say getting good tips is not related to just money. It could be you know, you trying to find something in a particular location, and then you just realize that is it not this person that I've attended to in the pharmacy, and because of that, that door is open to you. Or let me say that let me just give a particular example of what happened to me, you guys. There was a time I wanted to do something in the garden here in Abuja, and because of some reasons due to COVID, they had to lay some restrictions, and it had to affected like my decision. And you know, I was just there, I'm like, oh my gosh, what do I do? And they were not like, okay, I have to pay so amount. And then I'm like, yo, I didn't budget for this money you guys are asking me to pay, blah blah blah. Where I was currently still trying to negotiate with them, I just saw everybody trying to hail this man that just came in, and then I'm like, this person's face looks very familiar. And then I'm like, I just remember that I've attended to this man in the pharmacy. So I walked. I got to know that the man was like the manager of the garden or of the park. And you know, I walked up to him and I'm like, excuse me sir, good morning. No, it was not good morning, good afternoon. How are you doing? Blah, blah, blah. And he was looking at me like, yo, how may I help you? Like, why are you greeting me like that? And I'm like, oh, you don't remember? I'm like, no, I don't remember. I'm like, oh, my name is Yomi from the pharmacy. This is the pharmacy. She's like, oh yes, that's true. I remember. I can remember your face now. And I told him that these were my concerns, and you know, and he was like, and he told them like, no, allow her to do what she has to do. She doesn't have to pay. That day I was so excited because I wasn't even expecting that favor. So yeah, working in a community pharmacy can open doors. It can make you have very good relationship with your customers that can in turn open doors for you in places that you do not even imagine. Moving on to the disadvantages of working in a community pharmacy. First thing I have noticed in most of the community pharmacies around is that due to free access, you know, community pharmacy is very accessible, and due to this accessibility, people tend to disrespect or disregard pharmacists. People get not just pharmacists, anyone working in the community pharmacy. It could be the pharmacy technician, it could be the cashier. They tend to like disrespect them, they tend to disregard them. So I think working in the community, if you want to work in a pharmacy, then you have to brace up. You have to have an absorber to absorb all the insults, all the talks. You know, people would speak to you in a condescending manner. People would talk to you like you didn't go to school. And if you're young, you like someone that looks very young, and you know, and when people say, okay, I want to speak to pharmacists, and then they direct them to me, okay, yeah, that's the pharmacist. And some of them are like, how can you be a pharmacist? I mean, I want to speak to a pharmacist, and they're still not convinced that you're a pharmacist. And I'm like, oh my gosh, not again, not today. So yeah, that's one of the disadvantages of working in community pharmacy. People tend to disregard you, especially if you look very young. They're like, you're too small to be a pharmacist. And I'm like, okay. And you know, the funny thing about this is that for some people, as soon as they lay their complaint, and then they see that you're medically sound, that you know what you're doing, they tend to like upgrade the respect. That's what I've realized. Like in most cases, well, there are some people that they don't just really care. They don't really care. They don't mind. Like they don't care. But for some people, after you know having a conversation with you, and they know that you know your onions, you're on top of your game, the respect steps back in. So if you're thinking of working in a community pharmacy, you have to brace up for insult. Like people will literally come and they would insult you like you are a nobody. So working in a community pharmacy requires strength, extra strength from above. Pharmacists that work in community pharmacies tend to overwork, or let me say they are overused, because a lot of the pharmacies around are understaffed. I don't know why it always happens, but I don't know, maybe it's because the pharmacy owners, they all just already have a particular budget that they want to pay their pharmacies every month, or you know, every worker. But I've noticed that a lot of times community pharmacies are overworked, they are overstretched. You will see a community pharmacy working from 9 a.m. to 10 p.m. Why do you have to overwork yourself? Why do you have to overstress yourself? Like, you guys, so if you want to work in a community pharmacy, you should bear it in mind that you may not have a social life. You may have little to zero social life. Your Saturdays might be occupied, you have to be at work. Your Sundays, you have to be at work. I know that this is the disadvantage of working in the healthcare system in general, but I think in community pharmacy is kind of like overstretched, knowing that they can always get more staff, or they can always hire more people, but they will decide to still be making all the plenty money and be paying little tokens to start. If you're a pharmacy owner and you're watching me, I hope this video encourages you to do better, to treat your staff better, because it's going to tell on the quality of patients that come in to your pharmacy. The last disadvantage of working in a community pharmacy, which I think this point is a bit is very important, is pressure, you guys. You know, when I was in school, when I was in pharmacy school, they had always taught us in clinical pharmacy that, you know, pharmacy is supposed to be patient oriented, it's supposed to be patient centered. But in community pharmacy, you are put under pressure. You are kind of you are subjected to ensure that it is money centered and not patient centered. Now, what do I mean? The community pharmacy is built in a way that you have to make sure that business is moving, things are growing. You're moving the antibiotics, you're moving the this, you're moving that. I'm talking about Nigeria, you guys. This is what happens in Nigeria. You have been programmed to ensure that this is the this is the minimum amount that you can bring in per day or per month, and if you're not meeting up to target, well, you lose your work and blah blah blah. And because of this, in your mind you are beginning to think, okay, am I going to be patient centered or am I going to be money centered? This is a battle like I literally fight every day in my head. Okay, it's the patient first before the business. It's the patient first before the money. Patient comes to the pharmacy and they tell you that, okay, I'm cold for a few days. As a pharmacist, you're not supposed to give an antibiotic firstly as your first method of intervention. An antibiotic is a no-no, except you're sure that there's an infection or they've probably tried that other method and all of those things. But you see, community pharmacy has made a lot of pharmacists to be subdued under pressure. I'm not blaming these pharmacists, but I'm just saying that the pressure of work is crazy. They have been made to tell them, okay, you know what, you have to move the supplement, you have to move the most expensive drug to bring in the sales. So as a pharmacist working in a community pharmacy, you have been programmed to be under pressure, and you have to literally fight it in your head every day that, you know what, I am not going to be money centered. I am not going to think about the money alone. I'm going to think about my patient first, okay, and then think about, okay, this is my first line, my second line, and my third line. I'm not going to bring the third line because of money. No, I am going to think about my patient first. So one of the disadvantages of working in the community pharmacy is the pressure, the undue pressure that they put on you to bring in sales. And because you have to bring in sales, you have to sell the expensive drugs regardless of how the patient is feeling, or regardless of you thinking, okay, can this patient afford it or can they not afford it? Do you get my point? Yeah, so that's it. I hope you guys were able to learn one thing or the other from this video. As a pharmacist and you're watching me, if you think you relate with any of these points, do let me know in the comment section. And as a patient, if you think you have experienced any of these points I have spoken about too, also do let me know in the comment section. Thank you for watching this video, and please don't forget to share this video also with someone that you think needs it. I'm going to see you all in my next video. Until then, bye.